But anyway, even in general practice, we sometimes will see unusual cases. And so I had kind of an interesting one from many points of view. A lady that works at Carter Pet Hospital, had worked at Carter Pet Hospital where I work now in Lake St. Louis, brought her pet in, and she was not again working. Apparently she was one of our people at the front, receptionists. And she brought her dog in very, very lethargic, a sudden onset. And what made it a little more complicated is that the pet was intact. It had not been spayed. And many older unspayed females that go into heat periods twice a year eventually will develop problems with their uterus. They'll get all kinds of pus or infection in the uterus. It's called a pyometra, and it is life-threatening. So it's a good reason if you have a puppy. We see some pyometras in kittens, not very often. But anyway, one of the reasons why we recommend to spay a dog relatively young is so they do not develop this particular condition.
Yeah.
But she was smart enough to know sudden lethargy. It was a month after the pet had their heat period. That's classic for pyometras. And so she came in and says, I want x-rays taken. I hadn't looked at the pet yet, but I thought, well, that's not a bad idea. The x-rays would show me if there's enlarged uterus. It was not there.
Oh my.
It was not a uterine problem. Blood work, and I look at the blood work, oh my God, the kidney enzymes are off the scale, which would indicate kidney disease or failure, and that can be very serious. And another thing that set me off was the potassium was very high, and that indicates the kidneys have suddenly failed, and that's usually a pretty poor prognosis.
Ooh.
So I said, well, I think it's kidney disease. I think that things are guarded. We'll see how the next day or two go. Well, she agreed to start fluids, so we put an intravenous catheter in the animal's arm, and I think we had it for about 5 hours. It gave her fluids, and the pet seemed to be doing a little bit better with the fluids, and that was kind of strange because usually with this nasty sudden kidney failure, it takes more than fluids, or usually even spite fluids, they pretty much pass.
Oh, really?
The next morning I called her, and I said, well, how's the pet doing? She says, well, it's better. It's still kind of weak. It's not eating. Well, that night I had done more homework, and it turned out that not only was the potassium high, but the sodium was low. The electrolytes were off, and that is a classic condition for what we call Addison's disease.